Dr. Peter Landless and myself, I didn't feel strong enough to take this topic by myself, and so I invited my good friend to be here with me to share the podium and the platform. And I am convinced, Dr. Landless, that every single person in this room is here because he or she is interested in having a healing ministry in their own lives. They either want to be healed themselves or want to have this healing ministry in their communities, in their churches, and wherever they go, they would like to be instruments of healing. Now, we've discussed a little bit about this before. What would you say would be the characteristics, the character traits, the inner characteristics of somebody in the healing ministries?
Well, we've had so many wonderful presentations, Viriato, and I have been so blessed by the depth of presentation. And a confession, it's good for the soul. I thought there was going to be a tremendous amount of duplication, but there hasn't been. But in this particular component, we're going to do a little summarizing. Now, when you ask me what comes to mind about the characteristics of an individual who is involved in healing in their practice, we maybe need a little later to decide what is practice, but one of the characteristics that springs out at me would be integrity.
Yes.
Integrity.
And when I asked this to Dr. Landless, I had my list. And I gave him just 2 examples for him to get the concept. And he came up with the same that I had actually thought about. So integrity. But what is integrity? Integrity, truth? Is it associated with it? Truth?
Integrity is a real honesty. It's a Christ-centered honesty. Now, one of the things that brought integrity immediately to my mind was when you talked about, and you ask searching questions. Viriato sells himself a little short, I have to tell you this. When he said he didn't feel strong enough to do this alone, with the Lord's grace, he's stronger enough to do it. But when you talked about integrity in the research place, I was deeply impressed how Dr. Fraser used integrity in interpretation of results in the Adventist health study. Sometimes we as Seventh-day Adventists have a preconceived outcome. We have a preconceived audience, and so we want to conclude a preconceived result from our research. So we need to take research. We need to have integrity in the very core, the very way we conduct it, and the very reason for doing it. Now that spins off
so many things
into the healing relationships we have with those who work with us in research.
That's right, and we're going to touch on some of that. The second one that we both thought was actually competence. Competence. Are you competent to do the job that you're doing? Do you feel super competent or just competent?
You're asking me that in front of my bosses.
Oh, yes.
No, I'm not
Don't
competent.
ask me that.
I'm competent only in Christ. I mentioned during the devotional yesterday that there are 2 days ago, there are 2 components to our competence. One, we need to be well trained. It is important to have good, sound training in recognized, accredited areas and have those things to back us and give us credibility. And apart from that, when we look at the issue of competence, we need to have a dependence on Christ. I mentioned that my wife said to me, and she said it to me, she knows just when to say it. You do best when you are the most dependent.
And that's so true.
So competence is a balance between the best knowledge and dependence on God.
And we thought about compassion. Compassion. What is compassion? in a way, it is love in action. To be compassionate. Jesus wasn't just compassionate. He was full of compassion. It's love in action. He felt what people were feeling. He went right to the core. Compassion is associated in my mind with respect. See, when you have compassion on somebody, it's because you value that somebody, isn't it? Compassion. It's a key thing in this. Do you want to say something about compassion?
Well, I'm kind of bursting to say something.
I know.
Which is very unlike me. In Steps to Christ, page 58, the definition of who we are as Christians is who has the heart. Of whom do we love to speak? Who has our richest energy and our best efforts? Take that now. We are in a practical learning situation, summing up the issues of healing practice. Compassion of Jesus. How do I know that I've got it? I love the way that it's been put. When the things that break his heart break
my heart. Yes,
then
so true.
I'm practicing the healing compassion of Jesus.
It's so true. And I think that compassion is something that is from within. But what about alertness? Alertness. I'll never forget, I was being interviewed for a job in the UK, and they gave me the job, and I had, in the interview, I had to be at a consultation just with a colleague of ours, and I was watching him, and there was a man in his 40s that came. This man was obviously worried about his health. And his health, he wanted a checkup. When somebody says, just do a checkup, I don't know exactly what they're thinking, but no, he wanted a checkup. He was worried about his cholesterol. And he was really worried. And I saw in my colleague that he wasn't actually paying attention to his worry. He said, do you smoke? No. Do you have family history of that? He was in his 40s, and more than half of the population have high cholesterol. So do you smoke? You don't need to worry about that. But you could see the man was not happy, and the doctor was not alert to his worry. Alertness is to be, we actually put another word there, intentional and alertness. It's to be with your lights on. Do you know the expression? To have your lights on. To be watching others for their point of need. And then to go in. It could be his cholesterol. It could be his, many of the patients that come have many problems at home. And sometimes you've got that little, it's just a little opening in the door that gives you, and then you sense, oh man, if I'm going there, I'm going to spend half an hour here. But sometimes you have this, but we need to. Otherwise, I personally believe that if you're not alert, you can't have a healing practice. Am I saying too much?
No, you're not saying quite enough.
Okay. I can carry on, but it's not so complete
Because
without yours.
What you have just segued into such an important component. That when we deal and work with individuals, if they're coming into a consulting room, whether we are seeing them as a pastoral visit, we need to remember the real reason, as you alluded, as to why that individual is there. And I remember one of my teachers so clearly who said, remember the door handle question. The door handle question is when the individual is finished, you've had the consultation, you think, I'm going to get on to the next patient, I'm already 15 minutes behind. They stand at the door and they say,
by the way,
should I be worried about a lump in the breast? That was the reason they came to see you. The individual in the pastoral counseling setting may, after many, many discussions, say, is there help for addiction to pornography? Healing can only take place if we are intentionally alert and a little taken out of ourselves and looking into the life and the needs of someone else.
What about affability? What if we are stern, cold? I can't imagine you like that. Stern, cold, distant. Jesus, I can't imagine Jesus like that. He was a most gentle person. He probably didn't speak much. In fact, he wasn't a boisterous speaker. He was not, every word he said had a meaning. But he was very affable. He made the children, and you can test this. If children feel comfortable in your presence, and I think some of the greatest people in medicine are the pediatricians. If children are comfortable in your presence, I think you are an affable person. If they are not comfortable in your presence, there is something missing. There is something missing. Complete these.
I think the affability is so beautifully reflected right in our very first devotional. Elder Lowell Cooper referred to the man who was blind in Mark chapter 10. And he was calling for attention, and everyone was telling him to keep quiet. And Jesus paused and said, "Let him come." And what was the response of the people? They said, "Cheer up, get on your feet, he's calling you." There was an affability from Jesus, and there was, at the same time as he was affable, he was also willing to give the straight message. But affability, kindness, caring, no strings attached. It's so easy to be nice to people who are going to be nice back to you. It's to be nice to people when they are the people who call you at 5 in the morning. I had a patient who was my alarm clock. When the phone would ring at 5 in the morning, I could almost pick up the phone and say, "Good morning, Mrs. Hunter, how are you?"
What about 2 in the morning?
Well, not many of them did that, but they did. But nevertheless, and to come to the affability, there's a reality which we have to face in our Christian experience as health practitioners. My same coach that I mentioned with such affection a little earlier, one day after one of my alarm clocks had called me, and I said, "Oh yes, Mrs. So-and-so, yes, thank you, yes, I'm going up to the hospital." But when Roz had called me to the phone, I said, "Oh no, not her again."
Was that compassion, by the way? Can the doctor...
It wasn't. This is not a
we
confessional.
We battle with many of these things, and you know that. But carry
That's
on,
why I'm
sorry.
bringing it up.
Yes.
And then after that sort of straightening myself up, yes, my dear, thank you, I'll be up at the hospital. Roz said to me in a non-condemning way, this is probably 30 years ago, and I have not forgotten it. She just quietly said, "Sometimes I wish I was Mrs. So-and-so on the other side of the phone." Do our families wish that they were on the other side of the phone? That affability that comes from knowing that we are committed to being conduits, channels of the grace of Jesus.
And we didn't speak about that, but you all know that at times we feel impatient. You've never felt impatient, so we're talking to the wrong crowd here. And with that comes grace and forgiveness. We didn't put it there, but grace and forgiveness. We have been forgiven. And with our faults of character, it is a wonderful thing that after we get irritated at 4 o'clock in the morning or 3 o'clock because the toenail, whatever, it's... Then say, "Lord, forgive me. If that person called me, is because she or he is in pain. Could be emotional pain, could be physical pain. and I am an instrument of your love and of your healing. Now, sensibility. You talking about Jesus. Sensitive. Yes, it's actually sensitivity. 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 To be sensitive to somebody's needs. Sensitivity. I think one of the things that, at least in my experience, that has helped me to be sensitive has been my own experience, my own suffering. It has helped me to be sensitive to the suffering of others. I'll never forget one day I was lying in a hospital bed after having had an angiogram. They thought I had something, malformation, AV malformation in the brain, and so they wanted to do the angiography, and I it was under anesthetic, and I was recovering from that. And I was afraid. I was afraid. You know that after angiography, you can't move that leg for a while, You just put pressure, and I was afraid, am I going to get a clot down my leg or something like that? And I was afraid. I was actually anxious. And that helped me, and I had, there was nothing wrong with it, with me, but just those 3, 4, 5 hours of anxiety. Now, when somebody comes to us worried, they are anxious. Are we sensitive to our patients? Are we sensitive? It's all mixed, it's mixed with compassion, it's mixed with alertness and affability. Do you have anything to say about sensitivity?
I think that one of the crucial components that when we are in health care and when we are medical missionaries, we need to remember that individuals make themselves vulnerable to us by sharing their inmost thoughts and their tenderest worries. And we need to be sensitive. Some of the issues that they bring up we may feel are really non-issues.
But they are for them. For them, they are issues.
To that person,
yes.
It's the wonderful story of the person who was walking along the beach, and there were the starfish who were washed up by the surf, and she was throwing back starfish after starfish. And someone said, "What are you doing?"
Thousands.
They said, "There's so many of them around here. What are you?" To this one, it makes all the difference, and threw it back in. So that person's issue, when they are sitting with you as a healthcare professional, when you are sitting with them, taking to them the loaf of bread, which has more religion than a sermon, the sensitivity to their needs.
Yes.
Because it builds up to how Jesus work.
And it builds trust. I'll never forget the health expos. At the health expos, people usually spend about 2 hours going around into all the booths, and then they come to a counseling session, advice, 10, 15 minutes. And often people are, very often people are hypertensive. And so you go through the list, how's your salt intake, and how's your exercise, and then you touch the issue of stress, anxiety. And they often say, "Oh yes, doctor, I think that's where the problem is." And then you start seeing a little tear. What do we do if we are insensitive? If we are sensitive, this is what may happen. It has happened to me. And you said, Mrs. Jones, I see that this is an area of your life that is very painful. Let us go to that more private area, let us talk a little bit if you want. If you want, I'm here. I can tell other people to take over here, and we can just go over and talk a little bit. And it's amazing that in 2-3 minutes, you are in the deep recesses of somebody's life. And there, we need to be intentional and sensitive to share not just the physical care, but the spiritual care. Dr. Landless, I would like us to go on a journey. Unless you have something else to say about sensitivity, I would like to cover a few areas here that we previously discussed. Are there nurses here in the audience? Are there nurses? Are there medical students? Medical students. What about nursing students? As well. Are there medical doctors? Yes, many medical doctors. Are there health educators? People who give health talks and so on. Let us try and apply these to some of these. These are just examples. You can be physical therapists, you can be occupational therapists, you could be psychologists. And let us try and let us go to a nurse who works in a hospital setting, not an Adventist hospital, works in a practice, helping a doctor. How could we apply these to practice?
You conjure up so many memories in my thinking when you mention that. You know, nurses, and I'm really very scared because there's one right within range.
Yes, I'll protect you.
But I'll never forget working as a young student, medical student, in the intake ward of the busiest hospital in South Africa. And we had this matron in charge, who was really nicknamed the Dragon.
It was the second one. I also knew another one.
Well, no, this was complimentary when they called her a dragon. It sort of understated the case. And she would do nothing for anybody except chew you out for everything you didn't do right, and even when you did it right. But I had a wonderful mother who taught me to clean up after I made a mess and whatever I did. And so I'd put up IVs, taken blood from the patient, and the nurse, she came along, and I could see she was headed to me with insensitive intentionality and no affability.
And what else? No compassion?
No compassion.
Maybe integrity, we don't know.
I don't know about the integrity, but she was honing in, and as she got to the bed,
it was clean.
She saw that it was clean. That I'd use a linen saver. There wasn't blood on the patient's bed linen. That the syringes had been put away. And she even managed to crack half a smile. And later in the day, when it got so busy, this matron who would do nothing for anybody, can I do an EKG for you? Can I help you take... 20 years later, after I had been in the mission field, come back to the same hospital, specialized in internal medicine and in cardiology, she was the chief matron of that hospital. Came back as a patient, asked to be prayed with, and was a tremendous link in the healing ministry of many patients, but herself included. So it takes little things, and it starts at early stages. The students, the nurses, the medical students, the physical therapists, the occupational therapists, every component of health work, and also every member who's a medical missionary. It's in the little things that the difference is made and the healing comes.
You were a medical student.
I was, yes.
I remember for a long time. I remember many times, in the 4th, 5th, 6th year, 3rd year, going to the wards and having to prepare the cases for our tutorials, because we had to prepare these cases and we had to see the patients, and we were frightened. I mean, we were just so embarrassed, and often they tell us something, for you medical students, they tell us something that they are, of what they're really hurting or worried about. Sometimes it's a family member, sometimes it's a child, sometimes it's a husband. And I've never seen anyone complaining about touch. You said, Mrs. Jones, I feel that you're worried about your child. Is there anything that I can do? You've got a cell phone here, but you can communicate. But do you want me to call your child? Do you want me to call your husband? Is there anything that I can do? These people are anxious. And it could be in the medical practice. It could be in GP practice. It could be anywhere. That touch, that kindness, that intentionality and sensitivity is so, so important.
We have lost so much by the paperwork and administration, which has done away with the back rub and the fluffing of the cushions, the touching of the patient, the placing the hand, and when I got to Washington, and I still do this, I would just give my wife a little kiss as we part in the corridor. Someone said, PDA.
What's PDA?
Public display of affection.
Public display of affection.
So when the person
Patent
said
ductus
that,
arteriosus, you know?
that's exactly, when the person said it to me, I said, I know that as patent ductus arteriosus. What's it to you? They said, public display of affection. I said, if we had more of it,
The world
we'd
would
have
be
happier
different.
people.
Exactly. Exactly. Now, let us move to... Somebody was clapping. Yes, it is true. Now, what about research? There are some researchers here who work in the laboratory. They work with other colleagues. They work with colleagues not just in the laboratory, but they work with colleagues all over the world. They interchange ideas. They have results that they have to present. Or, how can you be in a healing practice in a laboratory as a researcher? We've had a few researchers here. We've got Dwayne here. We had Dr. Gary Fraser, and so how can you have these as a healing practice in your research laboratory? Integrity is so important. I have a friend, I'm going to tell you a story. I have a friend who works in laboratory. She's a very high up, PhD in virology and so on. And she actually revealed to me some things that was so disturbing to her that made her leave. And made her leave because there was pressure to show results which were not really true, but in order to get grants and so on and so on and so on. Now, is it happening? We don't know. But she felt that it was there. Integrity, so important. What about sensitivity? To whom? To your test tubes? What about your colleagues?
I think that the entire thread, in fact, it's a rope that runs through research, and that is integrity. Integrity in our research, in our preparation, in our analysis, how we deal with funds, and how we present results, and acknowledgement of everyone who's part of that team. Put their names on the paper. Yes. That is part of the healing and the appropriate way of being a Christian and practicing Christ's method.
Exactly. And that's where we would like to stop there and read this beautiful quotation. I think that you all know this. Christ's method alone. There's not another one. Christ's method alone will give true success in reaching people. The Savior mingled with man as one who desired their good. He showed his sympathy for them, ministered to their needs, and won their confidence, trust. Then he bade them, follow me. Amen.